at portoftacoma.com.
So as a technical sergeant, E6.
I served in Vietnam in 1969.
I am a U.S. Army veteran.
Have you ever helped a fellow veteran?
Of course.
Yes.
Try to always be there for each other.
I do my best reaching out to my brothers and sisters in arms.
Have you ever asked for help yourself?
It's always tough, right?
I can't say that I have. I mean,
If you don't have someone to kind of help you guide those thoughts, it can be really bad.
eventually, you just can't deal with it on your own.
I guess it's a part of the military too, right? Service before self.
It was drilled in, service before self.
And you start to question, maybe people would be better off without me,
When you realize that you're not alone, once you take that first step, there's so much support.
Good morning. I'd like to call to order the Health and Human Services Committee meeting for April 1st, 2025. It is not a trick. It is April 1st, 2025, and this is Health and Human Services. The time is 9:30. If the clerk could please call the roll.
Yes, good morning. Councilmember Yombe.
Here.
Councilmember Herrera.
Here.
Councilmember Krueger. Here. Councilmember Ayala. Here. And Councilmember Hitchin.
Here.
You have 5 members present.
We have 5 members present. We're also joined by Councilmember Morrell. We have the agenda before us with 3 presentations. Any changes to the agenda? Seeing none, we will consider it approved. We also have minutes from March 4th, 2025. It was a meeting I was not at, and so I watched the video, but if there are any corrections or feedback, otherwise, hearing none, we will consider the meeting for the minutes from March 4th approved, which brings us to item number 5, which is a review. Well, it's kind of a theme for today, and I'm going to turn this over to staff to introduce. Ms. Waterland, start with you.
Thank you. Madam Chair, members of the committee, for the record, my name is Carrie Waterland, staff for this committee. Today, absolutely, is a theme day. You have 3 presentations before you focusing on aging services and disability resources in Pierce County, senior center services in Pierce County and the funding recommendations of those. And then lastly, you'll get an update on the transition from Beacon and Lighthouse Senior Centers to the Parks Tacoma sites. Starting your first presentation today is the division manager of the Aging and Disability Resources Division at the Human Services with Pierce County. His name is Aaron Van Valkenburg. And with that, Madam Chair, for this first presentation, I will pass it back to you.
Thank you very much, and thank you to all our presenters that are here in person. It's fun to see you. Aaron, if you want to come to the podium, and then I think you've done this before, but you'll just say next slide, and we magically make it work between PCTV and the council.
Thank you. Good morning, Chair Hitchin and council members. Thank you for the invitation to be here today. Again, I'm Aaron Van Valkenburg. It's my privilege to serve as the division manager for the Aging and Disability Resources Division, which is one of the divisions in the Human Services Department. I'm joined today by several of our key staff who are subject matter experts in the event that there are any detailed questions and need to phone a friend. They are not far behind me. Next slide. So quick look at our specific vision and mission statement. I won't read this slide, but I'll say at our very core, ADR is an organization consisting of dedicated, mission-driven professionals who care deeply about supporting older adults and adults with disabilities. We are committed to ensuring that these individuals have access to the supports they need to live in their desired setting, which for most people means living at home with dignity and respect. Next slide. We wanted to just share that we are proud to be an area agency on aging, commonly referred to as a AAA. You'll hear me make reference to that several times throughout the rest of this presentation. And just some quick history, Pierce County was designated as a AAA way back in 1973 per county ordinance, or per county resolution, excuse me. Initial responsibility also included Kitsap County, and in the beginning there was a regional plan that covered both counties, but back in 1980, Pierce and Kitsap counties became single county separate AAAs. Traditionally, AAA services have been focused on serving older adults over the age of 60, but in 1995, AAAs became partners with the state in providing Medicaid case management services to individuals receiving in-home long-term services and supports. And that particular program serves individuals as young as 18. Next slide. There are 13 AAAs in the state of Washington. Obviously, with 39 counties, many AAAs cover multiple counties. All AAAs provide a common set of similar core services. Pierce, King, Snohomish, and Kitsap are all single county AAAs housed in county, or in the case of Seattle, housed in city government. Washington State, these 13 organizations together form a very organized association called the Washington Association of Area Agencies on Aging, or W4A. Key legislative advocacy and negotiation with our state partners happens primarily through our state association. At the national level, AAAs are organized under an organization called U.S. Aging that does comparable advocacy and work at the federal level, and we as ADR hold membership in both of those associations. Next slide. So a little bit about our role. As a AAA, we receive both state and federal funds that are specifically allocated to support older adults and adults with disabilities, and to ensure there's a coordinated system of long-term services and supports. Every 4 years, we go through a comprehensive local planning process that results in a strategic planning document called an area plan. We are right now in our area plan that covers the years 2024 through 2027. I wanted to mention that we have that plan, I guess, it solicits input from the community to identify gaps. It looks at service preferences, funding priorities, and specific goals and objectives are laid out in that plan in these 4-year increments. We have a 15-member volunteer advisory board. These community members are amazing. They're so essential to our work. In addition to attending regular advisory board meetings, we have some really active, involved committees. And just for example, we have an education and public awareness committee where advisory board members help us determine when and where outreach should happen in the community. We have an active quality improvement committee through our board where advisory board members actually survey service recipients and talk to them about their level of satisfaction with services. And they go out and visit our provider sites in the community. And we also have a planning allocations committee where they give us input on that area plan, that planning process that I mentioned, as well as provider and service allocations. Next slide. So how are we funded? Primary fund sources, well, first of all, I would say that all of our fund sources come through contract with the Department of Social and Health Services, with DSHS. More specifically, we contract with the Aging and Long-Term Support Administration, or ALTSA, within DSHS. And then we've just on this slide laid out what those primary fund sources are. We receive Older Americans Act funding, which is federal dollars. There's a state general fund source called the Senior Citizen Services Act that we receive. For family caregiver support services, there's a federal allocation and a state allocation. And then we receive Medicaid funds, which are, of course, a combination of both state and federal funding. It's important to note on the last bullet here that through these contracts with DSHS, they specifically spell out program standards, service definitions, client eligibility criteria, and staffing ratios. And for the most part, we don't have a lot of discretion over these service categories. Next slide. So that's just a quick look at our budget. A little over $32 million for 2025. We are the largest division within Human Services. We have over 170 FTEs, and that number is growing. While most of those are case managers, we do employ a number of program specialist staff who oversee contracting and program development functions for the indirect services that we provide in the community, and I'll talk about those in a moment. You'll see from the breakout that the majority of our funding is Medicaid. And you'll also see the portion there that's indicated as county general fund for senior centers, representing about 2% of our total budget. And we're, of course, going to speak to that in great detail in the next presentation. I think next slide. Data that I know you're familiar with, but I want to spend just a minute on today is talking about the fact that we have an aging demographic in Pierce County like the rest of our country. But I do think it's important to note, as that first bullet says, that older adults and individuals with disabilities enrich our communities through their diverse life experiences. The age wave is not a problem to be solved. It's more of an opportunity or a resource to be celebrated. Current data shows that a little over 20% now of Pierce County residents are over the age of 60, and that number is expected to grow to 25% of the total county population by the year 2030. And just the next slide just shows a graphic of that same data. If you're wondering why we use 60, I guess I would just highlight that 60 years of age is the definition of an older adult under the Older Americans Act, so that's why that standard is typically used. Women in Pierce County make up about 54% of the older adult population. And interesting, if you drill into the older adult data, and this is in our area plan, the fastest growing subset of the 60 plus population are individuals actually between the ages of 70 to 74. And then shortly behind that, or closely behind that, are the group 65 to 69 in terms of the fastest growing subsections of the older adult population. Next slide. Back in 2011, AARP started releasing a scorecard that ranked each state's performance for their long-term service and support system. And I should have said long-term service and support, previously we always referred to it as long-term care, but the current acronym that we like to use is long-term service and support. Updated scorecards come out from AARP every 3 years, and Washington State has always been ranked in the top tier in terms of performance. We were number one for a time. In the 2023 most recent scorecard, Washington State was ranked number 2. If you're wondering who's number 1, it's currently Minnesota. Not sure what they're doing in Minnesota, but apparently great things. But AAAs are a foundational part of Washington State's long-term service and support system, and we certainly feel responsible in part for that overall consistently high ranking as a state. Next slide shows you some of the visual, I guess, of the AARP categories that they look at. I'll just highlight a few of them: affordability and access, choice of setting and providers, and how a state is doing supporting family caregivers are some of the areas that they look at. Next slide. So in terms of what we do, ADR provides services in 26 distinct categories. Some services we do provide directly. Most of those are in the category of case management type services, and I'll touch on some of those in a moment. But many of our other key services, or essentially all of our other key services, are provided through contracts with some amazing community partners. We rely heavily on a network of almost 80 community providers with 104 unique service contracts. And listed a couple examples there of some of our partners, like Catholic Community Services. They provide nutrition services for us. They provide home care services, transportation. Korean Women's Association, we contract with them for senior nutrition, for home care, and for health home services. Hope Sparks is a wonderful provider for kinship services, and there are many, many more. Next slide. As I talk about some of our direct services today, I just want to start by highlighting something that's really important to us, and that's an overarching priority that we think kind of shapes who we are as an organization, and that's our commitment to providing culturally appropriate services. We have found that the best way to honor and value the culture, the unique culture and diversity of Pierce County, is to invest in staff that reflect the community that we serve. This model has led to better connections for our clients, better outcomes for the people that we serve, and we're convinced that it's the right way to serve our community. More than half of our case management staff, and there's about 125 case managers, are bilingual, and that represents 26 different languages. And in some of the more common languages in Pierce County, we are multiple staff deep in those languages. For example, we have 11 bilingual Korean case management staff. We have 10 bilingual Russian-speaking staff, 8 bilingual Spanish, 8 bilingual Vietnamese, 7 bilingual Cambodian or Khmer, and many, many more. But just to give you an idea of the depth in some of those core languages in Pierce County. So we continue to watch the demographics and the caseloads, and we're committed to hiring additional staff for additional languages as needed, or adding more to the languages that we already have on staff. We do offer specialty pay for bilingual case managers. We don't have time today, but there's a link on this video that's actually a great little insight into what case management looks like with an ADR, and it highlights the cultural diversity. And so if you have a moment, I'd certainly encourage you to take a look at that. Next slide. Let's see. So really, talking about direct services, the place to start is really talking about our Aging and Disability Resource Center. It's really the hub or the heart of ADR for services. There's one thing that I hope that people remember today. It's 253-798-4600. The contact information is on the last slide. We also have a highly utilized website and a resource directory. But that's the only phone number that we advertise. We don't advertise separate numbers for our programs. It's just 798-4600. Anyone can contact the ADRC, individual clients, family members, caregivers, concerned neighbors, friends, community members. And we're, of course, happy to help any constituents that may contact your office looking for help with resources or services. We're happy to help. We don't think of the ADRC as a one-stop. It's really more of kind of a first-stop concept. We don't do everything, but we can connect you with some really great partners in the community or refer you internally to some of our direct services. Last year, 19,544 calls were answered live by our phone case management team. And if by chance the call isn't answered live, the current wait time, according to our phone data, is only about 41 seconds. So you're going to get someone talk to a person pretty darn quickly. Sometimes these calls are quick hitters. Maybe somebody calling for, a number for a local resource in the community. But often those calls are much more involved. And we do what we call options counseling, which is reviewing the situation with the client or the family member and helping the individual connect with available resources in the community. Next slide. When it's clear that there's more to the story, or it just seems like a visit to the client's home would be a great next step, we will send one of our other team of what we call general case managers out to see a client in their home. We can help determine eligibility for services. We can assist them to apply for various programs and services. That general case management can be short, could be a one-time visit, or it could be a relationship that lasts for years. Referrals for that program generally come through the phone team. General case managers, they can authorize a few services like some limited personal care, an emergency response button, and they can assist clients with purchasing food and some household items. Next slide. I wanted to just pause here for a second because our next slide is about community outreach and education. And this is kind of so core and fundamental to what we do. We invest a lot of time and attention to spreading the word in the community. And so I'd like to invite up just for a moment, if it's okay, Matt Santelli, who's one of our education and outreach specialists. And he lives and breathes this work, and I wanted him to talk to you for just a few minutes today.
Thank you.
Right. Thank you, Aaron. Thank you, council members, for inviting us today. Matthew M. Santelli, Education and Outreach Specialist at Pierce County Aging and Disability Resources. And yeah, I'd like to touch on a little bit what we do in education and outreach. Last year, we did over 300 events across the county. This year already to date, we're at 88 events, including 32 that we did in March. Already this year, we've reached 1,400 different people in the audiences at the events we do. And our goal is just to fan out across the county, talk to as many audiences as possible and as many locations as possible. So I'll highlight some of the partnerships that go with the work we do. Number one, we've done the property tax exemption seminars this month. We had one in Puyallup, one in Sumner. The Sumner one was very largely attended, I think the biggest we ever had, and I think Councilman Herrera was there. I think we had over 100 people there, which was fantastic because we're there, we provide information there, we talk a little bit about the programs we provide, and that's exactly the target audience we're really trying to reach, seniors and disabled adults. Those will be ongoing through the year. In terms of external partners, we finished our movie series at Grand Cinema. We do a wintertime series, January, February, March. We show a movie for seniors and caregivers to come out. They get a free movie. They get popcorn purchased by our partner. In this case, on March 8th, it was Envision Home Health and Hospice that came out and provided free popcorn to those who attended. March 14th, we've been purposing our Soundview building to be more of a public event space. So we had our first resource fair there. We had 8 community partners that joined us. I think Councilman Yambe was there. He was kind enough to come out for that event. And we're going to be doing more of those events at the Soundview building, ongoing monthly. We're also doing targeted topic presentations there as well, in addition to the resource fairs. March 17th, I was out at Key Center talking to the staff at the Mustard Seed Project about programs and services we offer, so they're fully aware of what's going on. We try to keep them updated on a regular basis. March 19th, we started our Oh My Gosh Now What Dementia Information Series out in Councilman Kruger's area. That's at the Graham Senior Center, our partner on services there, our partner location there at the Evergreen Church. That series goes 6 weeks. And it's all about how you work with and care for a family member that might have been diagnosed with any of the different dementia diagnoses. I think we had 25 people turn out for that, and that's the first time we've been able to present that out in Graham, so we're really happy about that. And our expert cohort that does that is Chris Dowling and Jessica Gerard. So we're going to do that and then do it again in the spring. In the fall, I should say. We're doing that fall and spring of each year now. March 27th, we had a big event in University Place at our church. It's the Guardianship Summit. That was the first ever event we did with our partners at Healthcare Providers Council to talk about family members again who are in that world of having to be financial decision makers for someone in the family who's no longer capable of doing that. I did a panel presentation along with my colleague Robert Davey from the Pierce County Veterans Bureau. We talked about different programs and services that the county offers that can provide support to those who have guardianships in place or powers of attorney. And then yesterday, finishing out the month, we did a presentation on senior nutrition, again at our Soundview building. And I'm pleased to announce last year we had a huge project that included internal staff, external partners, where we put together a 30-minute video all about senior nutrition, including food banks, ethnic meal sites, senior meal sites, farmers market voucher programs. That's been showing on YouTube and on Pierce County TV, who helped us produce it. We're hoping to have that on PBS here soon. And I was told last week it was we were awarded a U.S. Aging Award regarding nutrition services for that video. So we're very proud of that because it was a big project. We ended up having to bring in staff on our ADR side, 9 different bilingual staff to translate for the closed captioning into different languages. So it was a big project. So we're really happy that that's been recognized and it's going to be viewed more widely when it goes to PBS. Touching a little bit on our veteran services, we have a ton of veteran services going on through our Veterans Bureau. This is kind of an example of some of the different promo flyers we put out and the different programs that they're doing. They're right there in our Soundview building, so they're seeing people all day long on a walk-in basis and on a scheduled basis. We have 2 veteran services officers in there, Mel West and Joseph Jimenez, and they're helping people with different claim services and things like that. We have one regular program that meets every Wednesday, and that's the Veterans, I always forget this acronym, it's the VHOG program. It's the Veterans Housing Options Group, VHOG. That's all designed to find homeless veterans, get them into the building, and connect them with housing services. We're also doing a regular VSO claims workshop that's monthly, and that's designed for people to understand that claims process, those who are veterans and survivors of veterans, especially under the PACT legislation. That's all about taking another look at claims for those who have been veterans and served in areas where they were exposed to toxic substances. We've had literally hundreds of clients, veterans, come in, take another look at their history, and have been approved for those claims. Even people that served in the Vietnam era who might have been denied claims way back in the 70s, they're getting those claims approved, and they're getting a significant amount of pension money to support them in their retirement. So we're really happy that we're partnering with our veterans programs to promote those. Also, periodically, I get out to Madigan and talk to their treatment teams out there. I'll be out there next Wednesday, actually. They invited me to come out to their cancer care treatment group and talk to them about the programs and services we offer. And then in June, we always participate. We have information table out at the JBLM Retiree Health Fair. That's a health fair that attracts veterans from Kitsap County, King County, all across Pierce County, Thurston County, to provide them with information about the programs we provide as well. Transportation, wanted to touch a little bit on about that as well. We do partner with Pierce Transit to make sure if we have clients that need transportations to services, to get them hooked up. Can they navigate public transit? Can we get them hooked up with shuttle services or runner services? We also partner with Catholic Community Services, volunteer transportation, to get the client into the services that they need. We always look if we can hook them up with Medicaid transportation through one of our caregiver appointments. Are they on a Medicare Advantage program that might offer transportation where we can get them to services? And then we're also kind of working just on a limited basis with the different ride services. The ride services, Uber, Lyft, and others are starting to move into that world where it's not just a matter of taking a senior or disabled adult to an appointment, but also offering them some hands-on assistance, especially if they're mobility limited. So we're just kind of dabbling in that world and working with clients on that. Plus, we have the Beyond the Borders system that provides some outreach transportation in areas that Pierce Transit doesn't run. We're also always thinking, too, of is it just a matter of getting client to services? How do we bring services to client? And we can do that through partnerships with Catholic Community Services for things like home-delivered meals. If a person's homebound, instead of getting them to a meal site, we can bring them 14 frozen meals every 2 weeks so we know that they have meals to eat. We can also do things like grocery store delivery. That's expanded dramatically post-COVID, and so our case managers work with the grocery stores to set clients up with grocery delivery. We can get medication delivery or mail order medication for clients as well if they can't get out to a pharmacy. And then we work partnerships, too, with certain services that actually bring medical services to the home. One of those is Dispatch Health. will actually send a doctor and nurse to the home of a client in need and assess what their needs are, and they can even prescribe for them. And then we also have a program called the RISES program. This is a program where we're trying to connect seniors that are homebound and don't have any connective devices at home to hook them up with a free laptop, teach them how to use it so they can stay connected with the outside world more. And that's been a real bonus because a lot of those clients simply have an old-style phone. They don't really communicate much online. It really opens up another world of services and contact for them if we can hook them up with that. So that just gives you a little flavor of the things we're doing in education and outreach. So thanks for all of you who have been out. I think all of you have been out to our events. We really appreciate you stopping by, saying hello, and offering the support that you always do when we're out there. Thank you.
Thank you very much. Matt, I'm going to ask, can you give those flyers to our clerks so that we can put them in the packet since you were talking about them? I don't think I saw them there this weekend. Thank you.
All right. Thank you, Matt. Just a couple more slides here. Maybe we can move to the next one. The other, just two more programs for direct services that I want to highlight today. One of them is the Family Caregiver Support Program. This particular program is really all about supporting unpaid family caregivers, a person who may not even think of themselves as a caregiver, but is just taking care of a loved one because that's what you do. There's a lot we can do to support that caregiver. We can authorize services that are listed here, one of them being respite, to give a break to that primary caregiver. We can provide information and referral to other community resources. We can actually pay, the program can pay for adaptive equipment and supplies. We can connect that caregiver with counseling services. In short, anything we can do to support the caregiver and make their job easier. We know that there are many, many more families that need this support. We've placed a really high emphasis on advertising and promotion for this particular program. We'd encourage anyone caring for a family member at home to call the ADRC. Again, that's the access point for any of our programs. Family Caregiver is not a Medicaid program. We can serve anyone. Depending on income, there may be a copay for a service like respite, but anyone can potentially be eligible. You may have seen some of the commercials that we ran over the holidays. We did a very big push for this program with some targeted advertising over the holidays, and we've used a number of very effective commercials and promotions. And we've linked one here in this presentation that we've used a lot over the last few years. It's a commercial that kind of focuses on changing roles when an adult child finds himself caring for a parent or an older relative. So again, it's linked in the presentation there. Next slide. And then finally today, for this part of it, I'm just going to wrap up talking about what's actually our largest program, and that's Medicaid case management for clients receiving in-home long-term services and supports. This is primarily the Community First Choice program and the COPES program. I referenced this program earlier. The individuals as young as 18 are eligible potentially for this program. A person has to live at home in the home setting and have functional limitations and unmet needs with and need for assistance with personal care. Our case managers each work with a caseload of about 75 clients. They visit these individuals in their homes and they complete a comprehensive assessment that confirms eligibility and establishes service levels. Specifically helps determine how many hours of in-home care a client will qualify for. And they assist the client to develop a service plan to meet their needs. Last bullet there is about nurses. We have 7 RN case managers on staff. They manage a very small caseload of clients who are very clinically or medically complex. And they also provide consultation to our case management staff and to clients and their caregivers. Next slide. The primary service that this program provides is paid caregiver assistance, paid in-home caregiver assistance. And caregivers actually help with things like personal care. This is bathing, dressing, using the bathroom, medication reminders. Also, they can help with household tasks like shopping, meal preparation, and laundry. Clients can also receive some key ancillary services to support them in their desire to live at home. Things like home delivered meals, home modifications. You know, we do wheelchair ramps, we do bathroom modifications, we widen doorways for wheelchairs, we do all kinds of home modifications. We can also help purchase specialized medical equipment and assistive technology. Next slide. Consistent with the demographic data that we looked at earlier, this caseload for Medicaid case management is growing month by month and year by year. Current caseload is right around 6,317. We are projecting to be right near 6,800 by the end of calendar year 2025. In this program, on average, again, it's hours vary widely across clients, but on average, a client receives 104 hours of paid personal care services per month. The average age of a client in this particular program is 65. This program is one of the primary reasons that Washington State has such a highly ranked system. Clients have choice. In Washington State, you have choice. If you need long-term services and supports, there will always be options like nursing homes, adult family homes, and assisted livings, and those are important options. But given the choice, most people choose to receive their services at home. In fact, in Washington State, 2/3 of the Medicaid-funded long-term care is provided in-home versus any of those other residential settings. And our program here in Pierce County is highly successful. We track as a performance measure in Open Pierce County, and a very high percentage of individuals are able to stay in their home throughout their long-term care journey. I think that is the end of my slide deck today. That's my contact information. Again, the ADRC is just a great starting point for questions about anything that we've talked about today. Phone team is there ready and willing to help in any way that we can. We're happy to take any questions you may have.
Thank you. I will look to my colleagues, and we'll go to Councilmember or Committee Member Herrera.
Thank you, Chair. Just a couple questions. Great presentation. We really appreciate the community outreach. It's really important. I always hear our constituents rant and rave and how great they are, so we appreciate that. So I'm going to ask a question on the cultural side of things. You talked about language services. Do we have any other example of any cultural things other than language services? Or are we just providing language services?
We with some of our providers for home delivered meals, for congregate meals, they serve, through KWA, they serve different types of ethnic meals every day of the week. So there are meal programs that do focus on cultural diversity. And, with the languages, I would say that, and maybe I didn't highlight this enough, it's certainly language is part of it, but culture is as important, if not more important. When somebody's going into somebody else's home, to know how to be effective and to communicate with them, how to be respectful, and how to sit down and do an assessment, we're going to ask them very personal questions. We think those connections, both culturally and language-wise, are so very important.
Thank you. Another question I had was on your budget and staff. Thanks for having that nice breakdown of where you get your funding and stuff like that. I had a question on the senior centers. 2% kind of goes to the senior centers. Is that comparable to other counties, or do you even look at that? I just wanted to make sure that we're doing okay on that.
I think we're going to touch on that a little bit next
okay,
presentation.
You're going to go on that?
Yes,
okay,
we will.
Awesome.
Mm-hmm.
And then one last thing on the aging wave
Yes.
here in Pierce County and the trends. Can you talk a little bit about that? Is it the baby boomer generation, or is it development of senior housing? At least in my district, we see a lot of senior housing, public, private. Private senior housing going up everywhere. And like my parents, they moved out of King County because they cannot afford to retire there, so they come to Pierce County. Is there a little correlation along with that, or is it just a demographics of our own citizens?
Well, it's certainly some correlation, I think. The data that we show in terms of why, the why behind the age wave is certainly it's the baby boomer generation aging through. It's increasing life expectancies combined with declining birth rates. That's what's really happening in America in terms of that trend. I will say, and we could probably have a whole separate discussion around senior affordable housing, something that our advisory board is very interested in. I think one of the main reasons why Washington State doesn't have the #1 ranked system right now is if you drill down into that data, there are things in that report related to where we're not ranked very high as a state is around accessible, affordable transportation and housing. Those are the two things that hold Washington State back.
Thank you. Thank you, Chair.
Thank you for the questions. Vice Chair Ayala.
Thank you, Chair. And thank you so much for the presentation. I have just a series of clarifying questions, so not very complicated. In terms of the general case managers, are they consistent in their service? Would folks see the same general case manager throughout, or does that change?
You would generally have the same person assigned to you. So if, like I mentioned, it was short-term or long-term, so if it is long-term, unless there was a reason to reassign the case, it'd be the same case manager you'd be seeing over and over.
Yeah. And then for the property tax exemption, around what age are you seeing people show up to some of these informational classes and start to have that knowledge?
I'm going to bring Matt up for that one. He's much more expert here than me.
Phone a friend.
Yep.
Well, I attended the one in Puyallup. My colleague Lindsay Hotchkiss attended the Sumner one, and then I did a mini one that a church requested for their congregation. We can go as young as 61 in the prior year for the person to be eligible in the household. But we really were working on directing information to the community because the household income limit jumped to $64,000 last year. For years it was closer to 46, then it jumped to 57. Plus they've added a whole roster of deductions that we didn't even know about in years past. So even if a person's a few thousand over that household income limit, the deductions can bring them under. And so just at a recent support group that I talked to, a widow and widowers support group, that runs the gamut from the mid-60s to mid-80s in the group. And people through that whole spectrum were telling me that there was 4 of them in the group that had just in this year been approved for the property tax exemption program. And those were people who in years past weren't eligible due to income limit. So we really see the gamut of ages, and we're really trying to find those folks. And the road show is really making a difference because the crowds are significant that are coming out. And people are shocked about their income eligibility, that there's no asset eligibility attached to it, and that the process is not burdensome in terms of how much documentation they have to show to prove that they're the owner and prove what their income is. And so the assessor's team is just doing a magnificent job. People come up to me and sometimes almost in tears at events, and they're like, thank God you told me about that program. We're saving thousands of dollars a year. We thought we were going to have to sell our house. I'm shocked at how friendly everybody was. I'm shocked at how easy it was to get approved. So that's one really we would ask all of you to be those force multipliers out there to tell people, you know, this process is happening. It's saving people money. It's easy. It's not totally burdensome like so many people experience in government encounters with staff, you know. So it's been great. It's one we always are promoting out in the field.
Thank you. Yep. And I'm glad the experience is positive.
It's absolutely all around, truly.
My next question's related to mail order medication. Are there any challenges or issues that have come up from folks around mail order medication?
Mail order medication. Kim, I'm going to phone another friend here. I'll let Kim introduce herself, but Kim oversees our case management operations in the Medicaid program.
Good morning. Thank you. We do have not only can they do mail order medication, but we have pharmacies that will deliver. We also have medication dispensers, so those can be taken to the pharmacies, filled, and then they dispense at the appropriate times. Or we can order from one of our partners, is Lincoln Pharmacy. They'll bubble pack and then actually deliver the medication to the client. So it doesn't, they can also get mail order, but we have those other options.
Thank you. Appreciate it. And just 2 more questions.
No. We have 2 more presentations. I will just remind everybody.
I'll keep it really quick. You talked about the 70 to 74 age range is the fastest growing age range. Do we know what % of the pie that is?
I don't have that in front of me, but that is in our area plan. So I can get you that data. I'll be happy.
Perfect. Thank you.
There's a breakout that gives, like in 5-year increments, what portion those subsets make up of the entire 60-plus population. So happy to send that.
And then in terms of the family caregiver support program, is there any way that we can support to augment that message? It's I know there's a lot of mixed generational families that may not even know this exists or just don't expect this to be a service? Is there anything that we could do to support this?
You know, we've been investing in more, I guess for us, bigger advertising. You know, we've done a lot of things over the years that are pretty small potatoes. In these last few years, we have actually invested more in some traditional media, both television as well as social media, and trying to get that message out there. And so, and actually producing some really high-level commercials in terms of our work with PCTV. So we have some good information out there. We don't have necessarily the budget to do large-scale advertising campaigns, but we also think that there's smaller things that can be done to make inroads into certain communities. So we'd love to have more dialogue around that. But it's been a bit of a disconnect with that program because people don't often self-identify as a caregiver. And so to know that this is a service that could support them, that's where the disconnect often happens. And so it's trying to reach people in ways to say, hey, you help take dad to the doctor or make meals. You're actually a caregiver, and there are services that can support you. But overcoming that disconnect has been one of the big challenges with that particular program.
Thank you so much.
Thank you. And Committee Member Yambe.
Well, thankfully, to save people's time, Councilmember Ayala took a majority of my questions. But I do want to also add a point to the culturally appropriate foods discussion, is that it's like sometimes there are people who in the world who eat rice, and that's the cultural staple, and then when they come to another country where it's like bread is a staple or something else, and sometimes it throws people off, just so that, you know, when it's culturally appropriate food, it just means that it's the things that people are familiar with, and it's helpful because then it's like, well, you know, I can wrap my mind around that. So but I do just want to say that I think it's a common thread up here that we all are very interested in caring for our senior population and doing whatever we can to learn about the topic and you know, address it as the best that we can. And I do want to give the department compliments for the Aging and Disabilities Resource Fair, because I learned, for example, that TPU has a assistance program for people in apartments, which used to be a struggle because, you know, they used to come to my old city and they used to say, well, we don't really have an apartment program, but it turns out that there is, and the Multicare has this PACE program, which can be read up on later. They should do a presentation here, but kudos to the department for being very accessible. And we've been having lately some inquiries from our veterans and senior population who are looking for a little bit more help on their utility bills. So I appreciate you coming here and giving us this presentation. So kudos to the department for all the work that you do.
Thank you for the comments, and we'll go to Councilmember Morrell.
Thank you, Madam Chair. I appreciate you letting me crash your party here. Just a question pertaining to, and thank you for the presentation, on your Medicaid funding, is there a formula that is used to get your funding?
Yeah, it's the Medicaid caseload is forecasted at the state level, and then it's a per member per month reimbursement. So the state forecasts what they believe our caseload will be, multiplied by the rate per client, and then we build out our budget based upon that.
Okay, is that caseload that the state pulls out their crystal ball and looks at, is it accurate for Pierce County?
Sometimes, you know, it's. I will say to their credit that they will adjust. So if we get through the course of the year and we're getting towards the end of a contract cycle and it's clear we're going to overspend the contract based upon the caseload, they will adjust and amend the contract and add additional funding.
Okay. One more question pertaining to and I assume you probably have a lot of data out there. Do you also keep data on geographic equity of your outreach programs to both urban, suburban, and rural areas of the county?
We do, and that's something we could speak to a little bit, but we have a monthly outreach meeting, and that is one of the things that we look at is, you know, where we had goals to be in the county, where have we not been, where do we need to be. I think this year in particular, Matt and the rest of the outreach team did a little bit of a planning day to try to be more strategic, or a little more strategic this year in terms of where we're going, in many cases informed by where we have not been in the past.
Okay, if you do have any of that data available, I'd like to look at it. Thank you. Thank you, Madam Chair.
Thank you for the questions and comments. Thank you very much. I really appreciate the tag team and just kind of the overview. I have two comments. One, just around housing. This council continues to receive questions and concerns around housing, how seniors can stay in their home. Tax exemption is one pathway, but we also look at repairs that are happening that they simply don't have a source of income to pick up an additional payment, or they need modifications. I know we have some small programs, but again, as we have an aging demographic who want to stay at home, I'm wondering if there's been conversations around what we might need to do as a county and a council to address a need to basically be more proactive in getting out in the community. So seniors who are physically able to stay in their homes, but their homes are not able to physically stand up around them. Yeah. Is there something that the group is working on?
Well, we've started partnering more internally within our department. So we have a monthly coordination meeting, or maybe it's quarterly actually, where we talk with the folks from our community action programs as well as the folks from our community services division, just about what's happening across our divisions and how we can coordinate. And from there we are getting, I think, into some further ideas. But I mean, this is a topic I think that needs a lot more attention. But we've been trying to be more purposeful about it. Last year at our retreat with our advisory board, we did a little deeper dive into this topic. This is something that they're very interested in too. We're challenged a little bit that we don't have dedicated funding in our aging budget for affordable and accessible senior housing. And so our best strategy has been, I think, to try to insert ourselves into conversations to make sure that when we talk about affordable housing, that we're talking about seniors. And our advisory board is always quick to point out that it's affordable and accessible. Those are the things that they always emphasize to us. But to answer your question, yeah, there's a lot more that needs to happen in this area.
Okay, and I saw the acting director stand up and walk.
Oh, she's ready.
So I was wondering if she had some comments, and then I will wrap up with this presentation. But
I do. Thank you, Helen McGovern, interim director of the department. And I think it's really prudent that we take advantage of this time where we look at perhaps limited finances and see what we can do collaboratively. And so we are sort of breaking down our silos internally and meeting. Our youth prevention group is actually meeting with TJ Bull from the juvenile courts to see how do we partner with them. That meeting's coming up. And within our own division, as Aaron said, we have community action, we have community services who work on weatherization and work with Habitat for Humanity, who does do repairs for homes for people who want to stay in their homes. So in answer to your question, yes, we're looking internally much more to partner with that. And then I wanted to make a comment on what Matt said about partnering with the veterans. I've only been there a few months, and my office is in the veterans section, so I get to hear the conversations they're having with folks about giving them benefits they didn't know about. And while I've been there, one widow found out that she was eligible for $300,000 of back payment that had never been they had not been able to access. And just a couple days ago, there was a gentleman in there who was just on the verge of being homeless, and they were able to find him $23,000 of funding that he was due. So they're working very hard to make sure that we take great care of our citizens.
Thank you for sharing those stories to help explain some of the really good work. It's one of the great things that local government can do. We're literally boots on the ground. So I think I'm just going to point out one additional kind of item. We are a Hidden Heroes county. It's for caregivers, but specifically caregivers of people who serve this country who have traumatic brain injuries or injuries that have made life more challenging. And it's like a network of caregivers. So it's caregiving for the caregivers. So just don't forget that group. And I don't know if this organization through ADR, if there's any overlap, but I know that it's one of the actions we took several years ago to try and just help, because sometimes people who are helping and caring for their loved ones feel like they're alone. And your program does a really nice job with respite, with supports to help them basically manage their own lives so they can be those caregivers. So people are not ending up in long-term care as hospitals, senior centers early, where they can stay in their homes. So thank you for all of that. we are going to move on to our number 6, which is our overview of senior centers. And we're going to turn this back over to Ms. Waterland to kick it off.
Thank you, Madam Chair, members of the committee. I'm still Carrie Waterland, staff for this committee, and glad to be here today. Per Ordinance 2023-65S2, just a little bit of background for you all, that directed the Pierce County Human Services to come back to the council by April 1st of 2025, today, to present senior center funding needs and recommendations. So today, and those needs and recommendations would be for the 26-27 biennium. Today you have Nellis Kim here to present not only those funding recommendations, but an overview of the senior center services. And that presentation can be found starting on page 24 of your packet. Without further ado, Madam Chair, I will pass it back to you to start the presentation.
Thank you very much. Ms. Kim, thank you for joining us. And thanks for being so timely with getting back here by the 1st.
It was a happy coincidence. Good morning, everyone, and thank you for making time to hear a little bit about senior centers and the results of our study. I'm starting with actually just kind of a general overview of senior center services here in Pierce County to provide kind of background and foundation for the funding discussion. Next slide, please. So we have 13 senior centers in Pierce County. These are organizations that are wholly dedicated to providing services for older adults. So there are other organizations that we'll show on the next slide, but of these senior centers, the first 10 on the list, which are highlighted in bright green on the map, are the ones that are currently receiving county senior center funds. The last 3 on the list, the Puyallup Activity Center, Salvation Army Puyallup Senior Activity Center, and Sumner Senior Center, do not receive county general funds and did not apply during the last biennium. Next slide. So there are an additional 7 centers that are more multi-purpose in their focus. So they may do some services for seniors, such as hosting a senior congregate meal site, offering exercise classes, fall prevention classes that are tailored to older adults, but they also have a focus on serving people of all ages, so youth, family, etc. And those 7 centers are located throughout the county. Of these, I would just point out Community Connection Place, Eatonville, Fife, and Stillicum and Tillicum all host congregate nutrition programs that are funded through ADR. Next slide. So this piece, I'm not going to talk about it a lot because you have experts in the room who will provide more detail. But one of the requests in the ordinance was to identify areas of the county that are underserved by senior centers. And you'll see as we go into that part of the presentation that Central Tacoma has actually become one of those areas. And that's because of the closure of the Lighthouse Senior Center and the Beacon Senior Center. Those services were transitioned through additional funding to Parks Tacoma to enhance their services for older adults. In terms of the impacts that it had on our programs, we were not contracted with the City of Tacoma Senior Centers. We did have nutrition programs operating 5 days a week at Lighthouse and Beacon, and worked very closely with City of Tacoma and with Parks Tacoma to ensure that those were transitioned. So we now have meals being served 5 days a week at the People's Community Center up on the hilltop, and we have meals 4 days a week at Eastside Community Center. Another organization is providing meals on Fridays there. So next slide. So I'm going to launch into the results of our study on funding for the senior centers. Next slide. So as Carrie referenced, an ordinance was passed asking us to take a look at how much it would take to fully fund senior centers in the 2026-27 biennium. And to also consider funding needs for underserved areas, and to look at whether there is a way to simplify the funding process. So to look at formula funding, needs-based funding, et cetera. What we did was that we partnered with the Research and Data Analysis Division of the Finance Department to really bring in their expertise in looking at trends, looking at what cost increases might look like, and to help us develop both the overall cost of funding, of fully funding senior centers, as well as how we could do this, if it's possible to do this with a formula. I would preface the discussion by saying the ordinance itself talks about senior centers anticipated to apply for the 26-27 biennium. The funding process actually switched to a 4-year cycle following the 2018 the last study on senior centers. So we weren't actually planning to do any kind of competitive bid or other process this year. However, if an increase in allocations is made, if the decision is to switch to a different methodology for funding senior centers, obviously we will support that this year to get the senior centers lined up for the 26-27 biennium. Next slide. So I wanted to start out by talking about where we are currently in terms of funding. So we have historically done competitive bids for senior center funding. Senior centers are required to apply through a request for proposal process. And because the funding available has been very limited, we have carved out what are considered eligible expenses under the RFP that the county funding can be used for. The eligible expenses were actually determined in collaboration with the senior centers. Most recently, we met in 2018 to revisit what were eligible expenses prior to that time and opened it up a little bit more. So you'll see on the slide some wages, so staff wages, the director's wages, the director's payroll taxes, office and operating supplies, certain types of professional services, utilities, rentals, those can all be reimbursed with the county general funds awarded to the senior centers. There are other expenses that we do not cover, such as repair and maintenance, travel, training, auto liability. We will not cover if a senior center happens to own a vehicle, and then purchase of machinery and equipment. A big one that we are frequently asked about, which can be a large expense for some senior centers. So some senior centers operate their own meal service programs. They do not receive ADR funding to support those, and they are purchasing their own food. They're paying their cooks. They're having to buy, new sanitizing machines for their kitchens. Those are costs that are outside of the eligible expenses currently. The other thing that I would want to mention, because I was asked this question while preparing this presentation, what the difference between an eligible professional service and an ineligible professional service is. Typically, the ones that we don't cover are related to independent contractors that are hired to do things like teach classes. We will cover things like CPAs, who do their financial reviews, bookkeeping, janitorial expenses, things like that. Next slide. I believe in your packets you did receive the full report from Research and Data Analysis. This chart comes from page 6 of that report, and what RDA wanted to highlight was how much money was distributed via the RFP, how much money was distributed in kind of pseudo-direct allocations from council members, how much was actually requested by the senior centers in the last RFP cycle, and what it costs to run the senior centers. So the chart actually shows the last 2 RFP cycles. So the budgets that they submitted for the 2019 RFP, which funded 2020 through 2023, And then the figures from the 2023 RFP, which is intended to fund from 2024 through 2027. You'll see that in terms of competitive allocation, $500,000 was made available. Of that, $100,000 is set aside for unincorporated senior centers. So that's distributed to senior centers located in unincorporated Pierce County via a formula. Following the conclusion of the RFP, some council members did make some additional allocations, some of which also had to be competitively bid. And so that brought the annual total allocation to $607,500. In terms of what was requested, and I'm just going to focus on the last RFP cycle, in terms of what was requested by the 10 applicants, that amounted to $859,840. Their program budgets, so what they provided to us to show how much it would cost to run their senior centers in 2024, is the $2.92 million figure. So when the request was fully fund the senior centers, that is how much it would cost to fully fund the 10 senior centers that applied for funding in 2023. Just a couple of things to note. So the $607,500, that only comprised about 1/5 of the total amount of funding that it takes to run those senior centers, and 26% of eligible costs. In the RDA report, they also showed that the eligible expenses are largely made up of wages, and our senior centers have all reported that the cost of hiring staff, paying for staff, retaining staff has increased significantly over recent years.
Now, so I'm going to interrupt you on this slide just to clarify. These numbers are based on only those that applied, but we had several senior centers that did not apply.
Right.
So if we actually wanted to fully fund senior services in the county, this is a much bigger, and I'm not saying that's what we're doing. We don't have a magic money tree, everybody, but this number is not reflective of that. This is just those that applied. Okay,
that is correct. Yes.
Thank you.
Yep. Next slide. Oh.
Committee Member Coover.
Yeah, thank you, Chair. And just to piggyback on that, what are the reasons why there are ones that are self-funding? How are they being funded?
So if we're talking about the three other centers that are like really strictly senior centers, the Sumner Senior Center is a partnership between the City of Sumner and Stafford Senior Living, which is a private for-profit corporation that runs like assisted living, independent living, and so forth. And so between the two of them, they are operating the Sumner Senior Center. The Puyallup Activity Center is city-funded by the City of Puyallup. And the Salvation Army Senior Center is funded by the Salvation Army. It's run and operated by the Salvation Army up on South Hill. The multi-service centers, a lot of them, let me check my list before I misspeak. I know that a few of them are also municipally funded, like Stillicum is a city community center. But some of them are also private nonprofits. So they are fundraising, they are, they're putting in the time and effort to raise funds. And some of them do charge like program fees, member fees, et cetera, for their different services and classes.
Okay, thank you. Thank you, Chair.
Thank you for the question. Please continue.
Okay, great. So moving on to the recommendations that arose from reviewing kind of where things stand with regard to funding senior centers. We would recommend increasing the total biennial allocation available to the senior centers. And we also recommend using a per participant based funding formula to allocate funding within specific parameters. So again, referring back to the RDA report, and we'll run through a couple of examples of these. The RDA report looked at a few different options for developing a funding formula. When we gather information from the senior centers, part of what we ask for is demographics, participant information, et cetera. And we look at both duplicated counts, unduplicated counts, as well as we ask for unduplicated counts of people who visited 5 or more times. That number could be anything, but part of the reason that we don't look at just pure unduplicated counts is a lot of times senior centers are hosting one-time workshops, like a one-time AARP safe driving class. AARP tax assistance is another really common one. Those individuals get counted in the participant counts, but they're often there just for that one class and they never come back. So what we are looking at are the people who are actually the users of the senior centers, people who do come back more than one time to participate in the programs. And part of the reason why we want to utilize a number that reflects repeat visitors is that we do want to incentivize the senior centers to really be offering services that are bringing community members back through the doors. We would also recommend, and this is actually in Pierce County Code, that an allocation be set for the senior centers located in unincorporated Pierce County, so just giving them a flat dollar amount, and again, we'll run through a scenario with that. We do believe that because of the dollar amounts involved, that there is an RFP process that would still be required, but what we would anticipate doing is simplifying that and making it really a way of establishing that you qualify as a senior center for the funding, and then putting the qualifying senior centers through the formula to allocate. The other thing that we would want the council to consider is utilizing allocation caps. So part of what we and our partners at RDA really struggled with was what were you looking for in the definition of fully funding a senior center? And it's our belief that if it's a municipal senior center, the county is likely expecting that municipality to still chip in and support that senior center. So it wouldn't be the county looking to fund at 100% every senior center that currently receives funding or that could apply for funding. Next slide. Okay. So this slide is actually in here to show you what happens if you use the funding formula on the current allocation, and why it doesn't work and why we believe that an increase is needed. So what we did was take the $607,500 and kind of run it through the process of a funding formula. A couple of other things to think of, to know about the way this worked out is that we did basically give a $10,000 base for every senior center that's in unincorporated Pierce County. We used actual client counts for 2024. So this is their client count unduplicated of individuals who visited at least 5 times. We put a 50% cap on the budgets of the city-operated senior centers, and we put a 100% cap so you could fully fund the nonprofit senior centers. And what you'll see in the far right column is what percent of the total budget this formula ended up covering when applied in this fashion. And virtually every nonprofit senior center took a cut under this scenario. A couple of the city senior centers actually saw a significant increase in their allocations as a result of this. So if you are unable to increase the allocation to senior centers, the funding formula will not work. I would say that we probably need to stick with a competitive process for better or for worse.
We have a question from Committee Member Krueger, and just in case it's about this data slide, let's leave it up.
Thank you, Chair. It was about the one before, but I believe they're related. I guess I'm looking at, was there a consideration of maybe some kind of a handicap in the funding formula, looking at the rural area does not get to have the density by any means of what it is in the urban area. And so there's hardly anything equitable about that. So I'm thinking like a handicap like on a golf course where...
That's a good question. We didn't do that. We really looked at capping the percentage of the budget that could be allocated to the senior centers. One way that could be addressed would be through the unincorporated allocation. So if you set an unincorporated allocation at like $30,000, $40,000, whatever the case might be, it's a way to compensate for, like, for example, Lakewood. It's a city-operated senior center. They have the highest number of people, repeat visitors in the course of a year. So we did not look at that, but it is something that we could.
I would appreciate that because it's quite the disadvantage when I have too small, one town, one city, very small, and there are no buildings, things around for these kinds of events to occur, basically, and then for them to get there versus in other districts where they have several cities and towns. That would, I think there should be a handicap applied to the very rural area. Anyway, thank you. Thank you, Chair.
Thank you for the comments.
Next slide. So this example is actually showing the formula at work with an allocation of $1.5 million. So again, it's just an example. But if you increased the senior center allocation to $1.5 million and kept everything else the same, so it's a $10,000 allocation for each senior center in unincorporated Pierce County. There is a 50% lid on municipal senior centers. There is basically no lid. You can fund up to the operating budget for the nonprofit centers. What you see here is that virtually everybody gets funded up to the cap. The one thing that I would note, and I actually made an error on this slide, the Mustard Seed Project, it's only 7% of their budget, and it is because the Mustard Seed Project has a massive budget. It's well over $1 million for their senior centers. But the anomaly there is that the Mustard Seed Project purchased a new database in the middle of 2024, and that is why they are only showing 44 participants returning for 5 or more visits. It's obviously an undercount as a result of the implementation of the new database, and we would likely work out a way to compensate for that were the council to move toward this type of a funding formula. The caps, just so that you note this, what they do is they really help to preferentially fund nonprofit senior centers. So again, this is just an example of capping the municipal senior centers and the nonprofits differently, but it's a method that allows the funding to be directed more towards the nonprofits rather than towards senior centers that do have other support. If we were to move to this methodology, as you can see with the $1.5 million allocation of the 10 centers that are currently receiving funding, all of the nonprofits except for Mustard Seed get 100% of their reported 2024 operating budget. Obviously, we would open up the expenditure categories if this were to happen because they would need to have the flexibility to use the funds on more than just the currently eligible expenses. Next slide. So a couple of other funding methodologies, and this was detailed on page 10 of the RDA report. A couple of the other funding methodologies that were looked at were, again, preferentially funding or applying some type of an incentive to senior centers based upon the number of participants that were at or below federal poverty level. And then also looking at a tiered funding model. The issue with doing incentives for participants below federal poverty level is that, at least at the present time, that information is provided voluntarily by participants. The vast majority of participants do not want to share that information, whether they are above or below federal poverty level. So our data is extremely poor. As an example, 2 of our senior centers reported that they only had 3 participants at or below poverty level, which we can make an educated guess is not accurate. And we have one senior center that doesn't actually collect this data at all for their participants. In terms of the tiered funding model, so this is Snohomish County's model for funding senior centers, and you'll see that what they do is they create 3 different categories of senior centers: a regional, a multipurpose, and a community, and it's based upon the number of participants that they serve. They then have a flat allocation of general funds for those senior centers. And Snohomish County happens to also add some behavioral health sales tax funding to their senior center allocations for specific projects. The issue with the tiered model, at least as it exists in Snohomish County, is that it's static. So if a senior center grows, so for example, you start out as a community center, you're now serving, 600 people, and you want that bump up in tier, the higher tier senior centers have to agree to take less money to create funding for you to move up. So it essentially, you're stuck. They've actually run into this. I spoke with their senior center program person. They've run into this. The senior centers are not willing to give up funding. So once you're in a tier, you're in a tier. And it's not flexible enough to really accommodate or promote growth. The other piece is that their senior centers are a combination of nonprofits as well as city-operated senior centers, and their tier methodology doesn't account for that at all. So you could be 100% nonprofit, but you're in the same tier as, the City of Edmond Senior Center, for example. So there's no kind of preferential funding for senior centers that have to raise their own money. Next slide. So wanted to move on into the underserved areas question and funding for senior centers. The RDA team used their magic to identify the areas of the county that have large older adult populations, but where those older adults are living the farthest from an established senior center. Those 2 areas in Pierce County right now are the Parkland-Spanaway area and then central South Tacoma. Basically what has happened is as the Lighthouse and Beacon Senior Centers closed, it created that gap in Tacoma for Tacoma's residents. Next slide. In terms of recommendations, our partners at RDA, again, looked at examples of funding senior centers, kind of a quote-unquote startup senior center, and what they determined was that an annual allocation of between $285,000 to $328,000 per site per year would be necessary to get a senior center off the ground. So that would be funding to pay personnel, to buy equipment, to get activities going, and also to have some type of outreach happening in the community to bring participants in. The other piece that we would recommend based upon our work with senior centers is that this level of funding be made available for at least 3 years. And the reason is that a single year of funding is not sufficient to have senior centers really establish good operational practices as well as build up the client pool that they could be moved into a formula-based allocation. I think Councilmember Krueger, Graham Kapowson Senior Center, they've done a great job, but it has taken them, they're in their 3rd year now, and we're really starting to see their board come together, their services come together. It's not something where you can do just a single year of funding, walk away, and expect them to really function well. After that period, after 3 years, we would expect to see that the senior center is on solid ground. They've started to diversify their funding sources. They have a solid participant base and could then be transitioned into the funding formula. And I think that's it for my presentation. Happy to take questions.
Thank you very much. Appreciate the detail, and the report really has a lot of excellent information to kind of base some of these recommendations on. I'm going to look to anyone to see if anyone has additional questions. Committee Member Yambe.
Thanks, Alice, for that presentation. It's been very helpful, and thank you for the ongoing dialogue and helping get me up to speed on a lot of these issues. So I was talking with one of our senior centers the other day, and they were saying that I threw out, hey, we could, what about the idea of public-private partnerships? And they said, well, foundations, the issues with foundations helping is that oftentimes they will give one-time funds for capital improvement or something, but there's very few funds that would fund ongoing operations and maintenance or, food prices. Is that kind of generally true?
Yeah, that's absolutely true. And I think with foundations, they also tend to have priority areas. And so finding foundations that consistently put seniors as a priority can be a challenge. And yes, foundations tend to like projects with very, very specific outcomes that they can point to versus paying for salaries year over year over year. Yeah.
Okay. Appreciate that. And appreciate the study and all that information. It's very helpful. And I know that in Mid-County, for example, that they've seen these big increases since Tacoma's too shuttered, and it seems that people go for their friends or people go what's familiar and or quieter depending, and so they've seen these big increases, and so it's just kind of looking at these numbers kind of makes me aware of that.
Yeah, both Mid-County and Point Defiance Ruston Senior Center have seen pretty significant jumps since the beginning of the year. And Mid-County is specifically asking where the folks came from. So yes, they're aware that they're getting a lot of the people who used to attend City of Tacoma Senior Centers.
Okay, well that's helpful for data purposes. Okay, thanks.
Thank you for the questions. Committee Member Krueger.
Thank you, Chair. I appreciate mentioning the Graham-Kapowson. And again, the disadvantage is the growth really isn't happening out there for them to draw more. But I think they would if there were a bit more in the transportation situation I had, where one of the fathers that loves going out there lives in a center in South Hill, and couldn't get transportation out there. But it was a very beneficial event for him, and they've kind of partnered with another venue out there for Wednesdays. But I guess also focusing a little bit more on finding ways for transportation out there, which an earlier presentation kind of perked my ears up for what they are looking at. So that was just kind of a comment to put in on that, and I didn't know if you had anything more that could be added.
Yeah, especially outside of the Pierce Transit area, it is very, very challenging to get transportation. A few of my senior centers have chosen to purchase vehicles, accessible lift-equipped vehicles, but those are quite expensive. They're like, we were buying used, and they're in the range of $80,000 to $100,000 a piece. And then the insurance, drivers, and gasoline just kind of adds to that. Yeah, it is a challenge. It's definitely a challenge. Yeah.
Okay. Thank you. Thank you, Chair.
Thank you for the questions. My last question, and this may actually kind of touch on what we're going to hear next, is we did not have any funding going to Beacon or Lighthouse from the county.
No.
Okay. No. Thank you. Actually, let me check. Councilmember Morrell.
Thank you, Madam Chair. Thank you for the presentation, Ms. Kim. Senior centers, what do they provide to their customers?
I think the number one thing that they offer over and above other services is connection with other people. The senior centers are oftentimes the only place where these older adults go, where they are around their peers, where they are able to spend time with friends. Because of things like transportation. Often they can't go visit their friend's house as easily. They can't get together at a restaurant. The vast majority of my senior centers the vast majority of Pierce County senior centers don't charge membership fees. They have a number of programs that are free for the seniors to participate in, so income is not a barrier. Many of them offer meals. And again, if they're coming to one of our meal sites and you're 60 or older, that meal is free. And the other senior centers that do offer meals, by and large, try to do that at no cost. Some can't. They just can't afford to do it that way. But many of them do try to do it at no cost. They also offer a lot of educational opportunities. The workshops that my colleague Matt spoke about earlier, many of those are done in partnership with senior centers. So they go out and they do the property tax exemption workshops. They do educational pieces on caring for a loved one with Alzheimer's or dementia. And they also do offer referrals. All of the county-funded senior centers are required to have information and referral practices in place. So if somebody comes and says, I'm really struggling to care for my husband, I'm really struggling to be able to afford, incontinence garments, what have you, they know that they can put them in touch with the ADRC, so that way we can get our case managers out there to meet with the family and talk about resources that might be available to them. Oftentimes they have their own resources too. A number of my senior centers operate small food banks, and they also have like equipment closets. So people have dropped off walkers, wheelchairs, other devices. They drop off, depends that, a neighbor or a spouse passed away and they have all these incontinence supplies to give away. So they're able to provide those to the community members. So they really do play a very critical role in maintaining kind of the health and well-being of the older adults living in the community.
Okay. So getting back to your point, so it's a social, emotional connection point to get seniors from being isolated and get them to interact with others. Okay. What is the difference between a senior center and an adult day care?
Oh, okay, sure. Yeah, an adult day is a much more it's a much more intensive program. So to attend an adult day program, you generally have some pretty significant disabilities in existence already. So right now in our county, I believe Cascade is the only one that's still operating an adult day facility. Those are staffed not only by caregivers, by nursing aides, but they're also staffed with nurses and oftentimes physical therapists, occupational therapists, and speech therapists. It's a partial day program, so you attend for 4 hours a day, and generally you are there to receive services that are designed to not rehabilitate, but help you maintain a certain level of functionality. At the same time, they're also there to give your caregiver a respite. So oftentimes family caregivers will help their loved one get into an adult day program, and during the time that a person is at the adult day program, they can, run errands, go see their doctor themselves, shop, clean the house, what have you. The other piece is that adult day is not free. I don't know the current rate. I want to say it's probably over $80 for that 4-hour chunk of time. Private pay is extremely rare in the adult day world just because it's very costly. Our Senior Citizen Services Act funds, a portion of that is available to Cascade to help lower income families be able to send their loved ones to adult day programs. But most of the people attending adult day, the service is either paid for through Medicaid, through a veterans benefit, or through a developmental disabilities benefit.
So you're saying we don't have very many of those in Pierce County?
As far as I know, we just have one. There used to be Cascade and Multicare used to run one, but Multicare closed theirs.
Okay, and you brought up Snohomish County, and the reason why is I attended a adult day program up there, and it was amazing. And they bused everybody in, and I imagine there was about 100 there. and they offered them that four-hour period where at the end they served them lunch, and then put them on the vans and off they went.
Yeah.
But it was really engaging, and you're right, some of them had obviously disabilities, mainly physical, walkers, maybe a stroke happened, but in interviewing some of the customers, their clients, they were, I mean, it was their point of getting out of the assisted living home or the neighborhood home that they were part of to actually engage at I would assume a higher level than a senior center would be. But it was, I know that in talking to the members or the clients they were on Medicaid.
Yes.
And so they weren't out of pocket paying. But I mean, I was really impressed by that program. So,
yeah.
Nice
Adult Day
if
is a
we could
fantastic
do that
model. Yeah.
type of a program in Pierce County. So anyway, thank you, Madam Chair.
Thank you for the comments, and we'll go back to Committee Member Gruber.
It's been covered, thank you.
Okay, never mind. Well, thank you, Nellis. Appreciate the work, and it looks like we have some conversation and decisions to make as we move into this budget cycle. So thank you.
Wonderful. You're welcome.
Okay, Ms. Waterland, we'll do a brief introduction on this last one, and thank you all for being here. I believe we normally are done by 11, so but we want to honor the fact that you're here, and we'll have you introduce.
Absolutely. Thank you, Madam Chair. Carrie Waterland, still staff for this committee. Wanting to raise your attention to your last presentation. You've heard folks talking a little bit about Beacon and Lighthouse Senior Centers. We do have folks today here from both Parks Tacoma and City of Tacoma to talk about that with you specifically. So from City of Tacoma, we have Vicki McLaren, who is the Systems and Strategy Division Manager, and from Parks Tacoma, Ralph Thomas, who is the Recreation Manager. So with that, I'll pass it back to you, Madam Chair.
Thank you very much. And Vicki and Ralph, thank you both for spending a chunk of time with us this morning and coming and sharing your expertise as we navigated this intriguing time, we'll call it.
Good morning. Good morning, and greetings, Chair Hitchens and committee members. My name is Vicki McLaurin. I serve as the Systems and Strategy Division Manager with the City of Tacoma Neighborhood and Community Services Department, and I have oversight over the human service programming within the city, the local government. But today I'm here to talk about seniors. And so, as you know, that the city operates actually 3 senior centers, owns 3 senior centers, and we operated at the time 2 of them. Through a conversation of how to expand our existing services, we contacted the Parks District, who currently was doing the work, and how we could actually look at how to expand what we were currently doing, continuing to offer those social emotional services, but also to offer additional services that we could not offer at our locations. And so with me is Ralph, and I'll allow him to introduce himself.
Okay, good morning. Ralph Thomas, Recreation Manager at Parks Tacoma. First, I want to apologize. I might have shifted that TV a couple times. I hit it with my head on the corner, so I'm sorry if I did. But no, thank you for having us here today. This has been a what we feel at Parks Tacoma is a very powerful move for the people of Tacoma as we shifted from Lighthouse and Beacon to 2 of our main community centers. One is the Eastside Community Center off of Portland and 56, and then the other one right now is our Eastside Community Center, and then People Center off of MLK. Ellis earlier put on one of her slides about Star Center and Northpoint, and those are to transition in 2026 into services. And so in 2026, we will have all 4 community centers providing programming. So currently what is different, I'm going to just talk quickly the difference between our 4 centers. Our 2 centers, Northpoint and Star Center, have regular scheduled programming. And you can sign up for it, show up. Multiple of those have a fee or a registration through the community center. What is different that we changed when the city came to us is we created spaces, what we call our senior hubs at People Center and at Eastside Community Center, where they are open from 8 a.m. to 2 p.m. where folks can come in, basically what they did at Beacon and Lighthouse, and they're able to come in and have a warm or a cool place, depending on the time of year. We got snacks. CCA, they come in and do lunches daily. And then what is great, what we're able to provide now is not only our classes, but we are able to, for example, at Eastside Community Center and at People Center, they both have a pool, and we're seeing participation now happening in our pool that did not happen at Beacon and Lighthouse. At Eastside, they have an indoor track that is heavily used, and believe it or not, we actually have some participants. And when I say this, we have a 94 young woman who loves to play pickleball daily. And so they are really maximizing what we are providing. We're able to, through this transition, we were able to bring over a lot of the, providers, volunteer and paid, who provided services at Lighthouse and Beacon, and that they are able to continue either in a volunteer status or an employee status with Parks Tacoma and continue those classes. So they have familiar faces. The members know what they're getting into. And it's really helped us as we transitioned into our centers. What's been nice is that we just wrapped up our third month of this at the two centers, and at People Center we're averaging mid-20s for participation, and at Eastside Community Center we average around 40 to 45 daily who are participating. Now, depending on if it's somebody's birthday or St. Patrick's Day, those numbers can shoot up because everybody likes to party a little bit, and so it's really great to see the participation, and we're winning people over as they come to our centers. Yes, change is hard, and what we're really finding out is at those two, Lighthouse and Beacon, what the real challenge is that they were really close to their homes, and they didn't have to go very far. Some could walk, some could, we do provide transportation from their front door to our centers through a contract with the city, but also when we do different activities through our 4 community centers, we do provide transportation. If you were to attend at Eastside, and for example, last December we had our winter ball at Northpoint, and we had 100 participants, and we were able to transport people over from the different community centers to be able to attend. So we know transportation is a challenge, and by partnering and working with the city, it's really been a great relationship to be able to help people get through our front doors and stuff. So, we talked about the meals, and what has really been eye-opening and very supportive is that we stay open on holidays, which, like Martin Luther King Day, President's Day, some of the other holidays, and working with the city and with our Parks Tacoma, we still continue to provide lunches. We don't shut the doors on those types of holidays. We do close on Christmas and New Year's Day and some of the big ones, but we are able to continue to provide services and meals for people when sometimes they might not normally get them. So, but it's been a great relationship. We work very close with the city, and we're winning people over. It's very important, as they spoke earlier, just to have the interactions, just to be able to come in. Now, it's a little challenging because some of those folks have gone to a place that has just been, senior participants, and it is truly a community center that we have our doors open at, and that they're not so used to have maybe 20 or 30 kids or youth in the building. And some, once a grandma, always a grandma. Once a grandpa, always a grandpa. So they don't have a problem talking, and it's really nice to see the generations crossing and talking, and that, boy, they both have attitudes and they both have love for each other. And so that's what's been really nice to see as we go through this. So go ahead, Bea.
Yes, thank you. So we don't have a prepared presentation for you, but we're just here to answer any questions for you and just allow that space and grace. So we're available to answer any questions.
Well, thank you both for being here. I will see if anyone has specific questions. I know I have at least one, but I always like to see if someone else has the same question. Okay, so my question is about the rollout to the other community centers. You said, so you have 2 now that were response to the closing, but the goal really is thinking to get further out into some of your other community centers. Does that, what does that look like as far as the transportation side of it? Because that's what we continue to hear. Is that built into this model change?
So yes, currently we actually contract with a third party to provide the transportation to the existing locations. And so when we expand to the additional locations, the other 4, then we'll have to look at expanding that contract as well, or look at what that might look like. So that would be the intent eventually, yes.
Okay, and is there a cost to participate if I show up in a day?
So we have 2 types of memberships. One is what we consider our lunch pass, and that is basically if you're going to come in, we have members that like to just come in, play cards, eat lunch and snacks, and get out of there. There is not a cost for that. Then we have our other community center membership, and we have our city-supported membership, where the city has supported about 110 memberships monthly for members to be able to continue to go. And currently that is $25 a month, and that gets you full service to the community center, all the classes, and the pool time, the gym time, weight room, and believe it or not, they're all used. And so, yes, there are the 2.
How about the slide? We had seniors use the slide at the East Side Community Center. Because it scared me.
I tried to get Vicki to go down the slide, but so Vicki and I both qualify to be in the senior hubs. But I think what I was told from our front desk staff at Eastside Community Center, they have had just a few participation.
Okay, that'd be a great picture. I think my last question is around if people live outside, thinking of the area that we're lacking services at this time in Parkland and Spanaway, are there issues if people come from Parkland and Spanaway to Eastside Community Center? Can they still access those services, or do you have to be a resident of Tacoma?
So we allow you to participate no matter where you are from. The city-sponsored memberships would not support those residents, but if they can once again go the 2 routes, if they wanted to get a lunch pass, which is free, or if they wanted to get a membership to the community center, and that is $25 currently.
Okay,
So, yes.
Thank you. So
And
appreciate
then-
it. Any other questions? And did I cut you off?
Well, I'm sorry. I'd also want to add, if you're also a Tacoma resident, we do support with financial aid, financial assistance. Because not only do we have the classes and we have the offerings at the centers, what is really popular are trips that we do in town, overnighters out of town, and sometimes the overnights do have a little bit higher fee, but they all there's financial support through all of them. So.
That's good to hear. Okay, I'm not seeing any lights come up with additional questions. Thank you again for spending the morning with us and coming in and answering our various questions, just sharing what you're doing to reach out to support seniors. It's a growing demographic, and we're all going to be one some way. So,
Yeah. So, thank you.
Thank you.
Yep.
Okay. So, Ms. Waterland, is there any other business before the committee this morning?
Madam Chair, I just want to direct your attention to 2 separate things. One is the person sitting beside me to reintroduce you to Mary Connolly, who started yesterday, and will be most likely sitting in this committee next to me as we have her pick up the housing and homelessness portfolio. The other is just to direct your attention to the work plan for your next meeting 2 weeks from now, which will be April 15th. We'll be having Margot Burnison from the Human Services Department, as well as any special guest stars she brings with her, to talk about the behavioral health improvement plan that you all did approve last year, that was inclusive of the opioid spending plan, to give you updates on that plan and where they're at, and to present you with a draft funding plan to consider for the 26-27 by an AM. So that's it.
Okay, thank you. Well, thank you again to all the county staff and to the various people that have reached out to us to provide feedback and ask questions around senior services. This is a concern for our county as we are aging, and how do we do that and make sure the quality of life of those that are choosing to stay here and grow old in our community can continue to give back, participate, and thrive, and eat and stay housed. Those eat and stay housed is important. And we have some of the tools, but continuing to think about how we work together to really solve this so that people can be here and be healthy and be happy. So appreciate the network we're creating and the collaboration. So seeing no further business before us this morning, we are adjourned. Thank you, everybody.